E-health is an emerging field in the intersection of medical informatics, public health, and business, referring to health services and information delivered or enhanced through the internet and related technologies. Between 2001 and 2011, the number of doctors using the EHR system has grown. What does e-health do? Improves efficiency, reduce administrative costs, help facilitate communication, and enhance patient care. The EHR provide precise, up-to-date, and thorough data about patients at the point of care. The EHR helps facilitate swift access to patients' records for more coordinated, efficient care. The EHR can securely share electronic information with patients and other clinicians. The EHR also helps providers more effectively diagnose patients, reduce medical errors, and provide safer care. The EHR can improve patients' and providers' interaction and communication as well as healthcare convenience. The EHR enables safer, more reliable prescribing. The EHR helps promote legible, complete documentation and accurate, streamlined coding and billing. The EHR enhances privacy and security of patients' data. The EHR helps providers improve productivity and work-life balance. The EHR also enables providers to improve efficiency. The EHR reduces costs through decreased paperwork, improves safety, reduced duplication of testing, and improved health. Implementation of e-health solutions can be costly and may divert funding from traditional health activities that are already strained or minimal in developing countries. Evidence for e-health, health informatics, telehealth, and e-learning application is sparse, poor, or non-existent. Investment in e-health is costly due to the ever-changing programs and systems. There is significant pressure being exerted on the healthcare system globally to deliver high-quality care in a more equitable manner to a great proportion of the population and ideally at a lower cost. The factors that affect the use of e-health: increasing of age, less affluent, the lack of education, those that are not interested in e-health, and those that are not interested in their own health. As with any update and change in a field, there will be both positive and negative views. One study by Button found that majority of leaders and physicians found the EHR to benefit the overall organization. Studies have shown that physicians and other healthcare providers have found fewer complications, lower mortality, and eventually lower costs. On the flip side, there are barriers as expected with any update. There are learning curves to overcome and employees and physicians that are not willing to change their routine. As offices and hospitals make the transition from paper to electronic records, the costs are a negative perspective for leaders. They have also found some hurdles to jump when using e-prescribing for patient prescriptions. Button, Burke, Haugland, Blumenthal developed a graph from their finding of article reviews demonstrating leaders' perspective on the implementation of the electronic health record. Their research demonstrates that overall healthcare leaders and providers have a positive view on the impact of e-health. E-health leaves room for many different forms of technology. One of the most important roles of e-health is for physician relationship with others. Technology used in a physician-patient relationship is email and the use of patient portals for patients and physicians to have ways other than face-to-face office visit or phone conversation. The ease of access allows patients to see what their doctor's instructions and notes are and allows for them to communicate any questions or concerns directly to their physicians. Physician-pharmacy relationship uses e-scribing. The physician is able to send prescriptions directly to the patient's pharmacy, and the electronic system will be set up for any interactions or allergy alerts. Next is the physician-physician relationships. The use of eHealth in this relationship allows the physician to log in to the internet and pull up a mutual patient's past history, records, labs, and orders in order to ensure proper and the best care for the patient. The physician other relationship includes online orders for labs, x ray, and blood work. The internet has made staying connected much easier and convenient for physicians, patients, and other healthcare facilities. An application is a program that runs on a computer or other similar electronic device in order to quickly and easily perform an otherwise difficult task or serve a particular function. Single application solutions are typically much simpler and limited, such as smartphones apps like WebMD or Lumosity. These type of e-health solution provides patient with convenient means of obtaining medical information or allowing self-assessment of specific aspects of a patient's health. Lumosity, for example, provides easy to interpret data on cognitive function. The majority of applications for smartphones are available on the internet as well as important aspect in it that allows access to those not fortunate enough to own smartphones. Although these e-health solutions are particularly convenient and widely accessible, they most certainly do not replace medical analysis and treatment from a trained physician. Unfortunately, access to such quick information enables a patient to self-diagnose themselves in order to avoid healthcare costs, often causing these individuals to develop false ideas about their health due to misinterpretation. An example is the electronic health record, which retains patient medical history. Various electronic data collection solutions can serve to ensure accurate patient billing in the revenue cycle as well as organized metrics for a healthcare provider, including financial data, patient satisfaction, and efficiencies. E-health delivery to the patient's population can vary a bit depending upon the particular solution. That being said, e-health solutions typically are consistent in that they need some form of hardware, for example, computers or cell phones. And for the software, most notably, applications are needed in order to be used. Delivering solutions through services. You can purchase hardware such as the computer, purchase software to run on the hardware, pay employees to input the information into the patient's EHR. This allows information to be accessible to the patient and to their physicians whenever it's needed, providing interconnectivity of access to medical history across the continuum of care. Unfortunately, many healthcare providers have been hesitant to switch over from paper documents to the EHR, despite of federal requirements such as the HITECH Act. E-prescribing, like most e-health solutions, also requires hardware and software implementation, as well as employees trained to use the technology. For example, e-prescribing allows electronic prescription for more accurate medication delivery by avoiding error caused by ambiguous handwritten prescriptions. Bad handwriting may seem like a minor error, but it can result in delivery of incorrect medication that could be the difference between life and death for many patients. How do healthcare providers acquire such solutions? Through planning what is needed for you and your office. You can choose a vendor, request a proposal, then you can choose the type of support needed. Once that is done, you can pull all your information together to make your final decision. Choosing the right solution by acquiring the right vendor can be difficult. Main important thing is to write down what is important to the practice and what you're trying to accomplish. The most important factors to consider while searching for the best EHR are its functionality, ease of implementation, cost of ownership, and other related services offered by the vendor. Ideally, the product must have all of the features you need and should suit your budget. Ask if there's any hidden costs such as implementation and maintenance charges. You should also find out if the training is provided by the EHR vendor. The top 5 vendors in today's market are eClinicalWorks, Allscripts, Epic Systems, Practice Fusion, and NextGen Healthcare. By going to different conferences, it can help you choose a system that best suits your needs. Internet searching by going to different vendor sites and see what they offer. Reading reports and different articles on different vendors and what they offer can help also. Talking to fellow colleagues can also help in choosing a proper vendor. All healthcare providers, from physicians, nurses, technicians, clinical staff, and information technologists, use eHealth. Patients are now accepting the idea of being able to manage their healthcare via a web-based system that is available to them for their medical information. The users of today's EHR system want the system to be user-friendly. There are a lot of medical information available to all healthcare providers regarding their patients. It's easy to access and readily available via any wireless device. Healthcare providers are adapting and enjoying the system because it's a better way of providing accurate information. What do the users of EHR think? On a positive note, the physicians are saying that they like being able to access the patient's information via the EHR. Some physicians are saying that they like how EHR has improved their ability to provide guideline-based care. On a negative note, EHR users are saying that the solution does not meet the practice's individual needs. They are also saying that the medical practice has not adequately assessed the group's needs before choosing an EHR. Analysts have stated that there will soon be a shortage in the amount of primary care physicians. Studies have shown that as of 2009, as many as 72% of office-based physicians has the EHR system. If a range of health information technology were to be fully implemented in 30% of the community-based physician offices, demand for the physicians would reduce by about 4% to 9% through gains in efficiency. Delegating more care to nurse practitioner and physician's assistants could support reduce the demand of physicians by 4% to 7%. Similarly, if generalist physician provided more care now being provided by specialists, demand for specialists could decline by 2% to 5%. Use of HIT could help address regional shortage of physicians by allowing 12% of care to be delivered through the visits conducted in separate locations and at different points in time. These estimated impacts could more than double comprehensive HIT system were fully implemented by 70% of community-based physicians. Due to the Affordable Care Act, there will be an increase in the amount of patients needing to be seen, and therefore an increase in the amount of physicians needed. If a range of health information technology were to be fully implemented into most doctors' offices, this could greatly impact the need for doctors and actually reduce the need for an increase in the amount of doctors needed. Value refers to the intended benefits from the clinical adoption and meaningful use of the eHealth system. Value can be in the form of improved care quality or productivity in providing services. It can also be measured in these areas in terms of changes in care processes, healthcare outcomes, or economic return. The framework for clinical adoption and meaningful use. The reality is, we can assign value to the use of these programs through how the program adapts to our needs, provides safety to our records and ourselves as patients, and it can help with the efficiency of helping patients in general. E-health and interconnectivity could be said that it is the wave of the future. However, in reality, the future is now. There are physician offices who are implementing these changes in present day. The more offices that utilize this advanced technology, the more efficient they will become. And in turn, there will be a lesser need for as many physicians. Of course, this technology cannot and will not replace the hands-on care that a physician can give a patient, but this technology can give a patient better insight into their own health and how to maintain it.